Hi there, welcome back to the Spark is Love. So, talking about prevention, we've talked a lot in the past year about things and thoughts and actions that we want to do and we want to implement to lead healthier lives. But there are some things that we're doing unconsciously that can actually sabotage this healthy lifestyle. And one of it is not taking medications correctly. Okay, so I want to spend a little time just to share with you some important questions and tips about taking medications correctly. When I say medications, some people say, well, I'm not on any medications, but they take 15 to 20 supplements. So this applies to anything that you are taking on a consistent basis, whether it's herbs, vitamins, supplements, minerals, whatever you're taking, you want to take it correctly. Okay, so some questions I have here, a little pamphlet from the FDA, and I'll add my little nursing twist and break down some things for you. Okay, so some questions you want to ask is, what is the medicine's name, right? Do you know what it is? Does it have a label on it? When it came in, maybe you ordered it off of the internet, right? So you want to know the name, right? And you want to know, is there a generic available? Now, sometimes the generic works just as good and it's half the price. Not because the medication is expensive means that it is effective for you. So you want to know if there's a generic. Okay, why am I taking this medicine? It's so easy for the doctor to prescribe a medication and you just add it to the list of medications you are already taking and you don't even know why you're taking it, right? They call it polypharmacia. You want to know every medication, exactly why you're taking it, and if you still need to be taking it, okay? When should I take this medication? Sometimes we take it when we feel or when we remember, but certain medications are better when you take it at certain times, right? So timing might be like, for instance, blood pressure medication is best when you take it first thing in the morning, so it can work throughout the day. Some medications, such as medications for diabetes, you want to take it around meal times so that you don't have a sudden drop in your blood sugar levels, right? So you want to be aware of the timing of your medication. Next, should I take this on an empty stomach or with food? And a lot of times we don't ask this with over the counter medication. Some medications, like over the counter pain pills like ibuprofen, can be really hard on the stomach. And so you want to make sure you are reading your labels to see if you should take this medicine with food. Is it safe to drink alcohol with it? And for most medications, the answer is no. But you want to make sure that you know that if some medications, it can actually be very, very detrimental taking it with alcohol. So, even talking about alcohol, I have some patients ask, should I take this medication with fruit juice? Should I take it with water? Should I take it with soda? Some people think it doesn't matter, but for some medications, it really does. So you definitely want to talk with your provider, okay? If I forget to take it, what should I do? Great question to ask your provider. And you also want to know, if you have not taken, what you should do if you skip one pill versus if you skip a week's worth of pills is a difference. So have that clarity with your provider. If I don't take it this one time, what do I do? If I don't take it for a week or a month or a year, could I just pick up and start taking this medication again? Or do I need to do something different? That's what you need to ask. Also, how much should I take? And it might seem very simple. Take a pill, take two pills, right? Or take a shot, right? But sometimes between your provider prescribing it and the pharmacy filling it, there might be a difference with what is prescribed or what they told you to take versus how you receive the medication, right? So definitely not just ask your provider, but make sure if there is anything unclear on the bottle and the packet, run it by your pharmacist before you take the medication, okay? How long am I to take it? This one is important. How long to take this medication? So many people start on medications and just continue a lifelong habit. I will tell you the number one culprit in my nursing practice that I have seen is omeprazole, or you have those anti-acid proton inhibitors like that people use for acid um, as I say omeprazole, but Prilosec, that's a big one. If you read the directions on the box, you will see most of those medications say do not take past 30 days unless prescribed by your provider. So you want to make sure that you are not taking a short-term medication as a long-term solution. Some of these medications are there to help you, right? But in the meantime, I'm all about prevention, taking steps to change your diet, change your lifestyle, right? Will help you to use it in the short term and not have to have it long term. So that's just my little spiel on it. And the last one is, what problems should I watch for? So some medications, they may affect, you may be taking it for one thing. For example, you may be taking a medication for diabetes, right? But you're looking out to say, okay, this is supposed to bring my sugar low. So you're looking out and you're making sure, I want to make sure my blood sugar don't drop too low because that's why I'm taking the medication. But certain medications, right, like diabetes medication, you might want to look out for liver, kidney issues, right? Blurred vision, right? So it might be the problems you're watching for may have nothing to do with the actual reason you're taking the medication. So this is something you want to ask your provider. What should I look out for? Okay, knowing your side effects. I'm doing this because I want you to be an informed consumer. Please take care of yourself. Something that this talks about is don't take any medications in the dark. Something I would add is not just taking it in the dark where you cannot see, but taking it in the dark where you do not have mental clarity of why you're taking it, what purpose it serves, or what you should know about this medicine. So make sure you are lit up physically and mentally when you're taking medication. Okay? I hope this was helpful. Please leave in the comments your thoughts on certain things that maybe near misses that you had, or certain things that you thought was helpful that you can share with others as to how taking medications properly helped you, or certain things that you didn't know that you found out maybe the hard way that you want to give other people a heads up. I look forward to hearing your comments and interacting with you in the comment section. Thank you for joining us, and I will see you next time.